This component of lecture covers a portion of the chapter 15 in your book, when we're really talking about what the physiological kind of responses of the body are. So basically the discomforts or joys of pregnancy. So one of the most common things that we'll hear from people, especially in the first trimester, is fatigue, particularly common early and late stages as well. And then we just kind of encourage with that resting, napping, alternating, activity and rest, maybe using energy conserving techniques, that sort of thing. As pregnancy progresses and as the uterus enlarges, a lot of women will experience some dyspnea or difficulty breathing or catching their breath. Sometimes we can help this with a little bit of physical therapy, a little bit of posture improvement, light exercises, and stretching. However, it's really super common for someone to get winded at the top of the stairs type thing. And part of that is just simply because of the physiological changes as the body adapts to having a baby in there. The lungs just not having quite the capacity they had, and so then waiting for that rib cage to expand. Once that happens or the baby drops, then typically they'll have some relief from that. We do say that sometimes people will have a lot of congestion, nasal congestion, kind of sinus type things going on, and that's due to the estrogen during pregnancy. So we recommend nasal sprays, humidifiers. Lightheadedness is fairly common, especially early on in pregnancy. That's something that sometimes we'll see with a little bit of anemia, but also we see it as they just kind of start to adjust to uh, that lack of return. So the progesterone dilates the blood vessels. The placenta is, definitely creating this blood reservoir within their body that doesn't have a high pressure system attached. And that's what causes that orthostatic hypotension. Of course, we want to make sure that we're not having any cardiac arrhythmias, abnormalities, that type of thing that might be causing lightheadedness or fainting. So we take it pretty seriously until we rule out that, and then mostly we're just encouraging a lot of fluids, sitting, standing slowly, that sort of thing. And then supine hypotension is what happens as the uterus grows and enlarges. The weight of the uterus, whenever someone is placed on their back, compresses against the vena cava, and then that basically slows all of the flow back to the heart. And so that's really common for anyone who's been laying on their back. So we do what we call either a side lying or a modified side lying, where we tilt someone either left or right, doesn't matter, we're displacing the uterus. In certain cases, like in the operating room, you may hear someone say, I need someone to displace this uterus, and they'll be tipping the patient to the side. Or you can do it manually by holding the abdomen in a way that it relieves the pressure from that vena cava. So one of the first signs that we typically will see with supine hypotension is nausea, clamminess. Sometimes we'll see a spike in heart rate followed by a drop in heart rate in mom, and just a really unclear feeling of just being unwell and feeling nauseated. A lot of times they'll vomit as their blood pressure drops. And so that supine hypotension is usually fixed just by positioning. You'll see us use that in labor and delivery a lot, but it's also why we instruct women who are pregnant not to lay on their backs when they sleep, to definitely do a side lying position. Another common symptom that we see during pregnancy is some swelling, some minor swelling that comes and goes. We typically will advise some light exercise, avoiding long periods of sitting or standing, alternating, activity and laying down, and then elevating the legs whenever possible, especially if they're on their feet a lot during the day. We also see that some people will experience some varicosities during pregnancy, and again, this is a result of that progesterone causing the uterus to relax, and that works on the smooth muscle. And as that hormone is produced by the placenta, it's so that the uterus won't contract and expel the baby. But at the same time, it still acts on all of the vessels that are in the body and relaxes those smooth muscles of that. So the blood flow return back to the heart is poor just due to a lack of tone in those veins. And then that's typically what will cause some pooling in some areas, and those will be those varicosities that we see. Typically can also be very painful and uncomfortable. Some people can actually get those varicosities on their labia, which is super uncomfortable. We recommend icing. Other things that we also recommend are going to be compression stockings. And we, of course, recommend those to help return that blood flow. So they should be a decent millimeter of mercury pressure back up. Other things that we see because of that extra fluid in pregnancy is temporary carpal tunnel syndrome. We see that with edema around the nerves of the wrist as they, especially if they have repetitive activities, but really it's just that swelling that's putting a pressure on it. Sometimes we find that people get some good relief from going to a chiropractor. Some wear braces. It just depends and varies. Headaches are common during pregnancy, but they aren't necessarily because of pregnancy. Sometimes they are. But headaches are something that we have to take very seriously because they can be a serious indicator of preeclampsia, which is gestational hypertension or a medical emergency basically for mom and baby where the blood pressure goes up too high. So anytime they present with a headache after 20 weeks, they generally need to be kind of really followed for a little bit to make sure it's not a blood pressure issue. Some people that have migraines will have them more frequently during, so it's good to get a good history of their headaches and whether or not they've seen a neurologist. There are some medications that we just can't give. So like normally they may take something like Imitrex or another medication that's fast acting for of course due to pregnancy reasons we may not be able to allow people to take the usual medication that they take. So oftentimes we'll treat with Tylenol, and then if that doesn't cut it, sometimes we'll do some caffeine. So sometimes you'll see us use some alternate headache medications that we don't use with normal populations. Keep in mind that headaches can also be sourced from strain on the spine. And so when we think about the displacement of kind of everything that's normal in their body and that changed kind of sense of balance and center of gravity, they tend to develop that lower lordosis and they may end up with more cervical strain. So sometimes the best remedy for headaches during pregnancy can be a physical therapy consult or a chiropractor that can help kind of alleviate, or a massage therapist that can alleviate some of the musculoskeletal issues that are happening that are underlying those